Hi, everyone. Thank you so much for joining us today. My team and I are very excited to be with you. This is the who, what, when of the Colorado Capitol and why it matters to you from the Colorado Medical Society. My name is Emily Bishop. I'm the Director of Government Affairs for the Colorado Medical Society. I'll turn it over to Jerry Johnson to introduce himself.
Hi, Emily. Thank you very much. I'm excited to be visiting with a group of doctors this evening. I've had the privilege of representing physicians for about 3 decades at the state capitol.
Dan?
Hi, thank you, Emily. My name is Dan Jablan, and I have the privilege of representing CMS with Jerry Johnson at the Colorado Capitol. I'm now going in my 4th session working for CMS and with Jerry down at the Capitol lobbying for you for your benefit.
We're very happy to have this fantastic lobby team. Chet, would you like to introduce yourself?
Hi, everybody. My name is Chet Seward. I'm the Chief Strategy Officer. I work closely with Emily and Jerry and Dan, and I lead the policy and advocacy work at the State Medical Society. It's great to be here.
Fantastic. So we're going to start this off today with just a little bit of a discussion on our 2022 anticipated priorities as we're getting into the last couple of weeks before session starts once again. So if I can talk at the beginning a little bit about the threats or challenges that are facing physicians in the coming session. First of all, I wanted to note scope of practice expansions. Of course, every healthcare provider is extremely valued and extremely important to positive patient outcomes, but time and again, we see that physician-led teams are the most efficient for patients and those positive outcomes. So we do know of a play by physician assistants to try and get some independent practice. And we also know of optometrists trying to expand their scope specifically into surgery. Both of these challenges are things that we're very aware of, working on with many partners and stakeholders and legislators, and we're well positioned to counter those. We also know that there may be continued cost of care legislation targeting physician reimbursements. Reducing cost of care is certainly a CMS priority. We feel it's very important, but we don't feel that physician reimbursements are the proper place to look for healthcare savings. We don't feel that they are the driving factor behind expensive healthcare. We're always looking at medical liability challenges, and we are always working with our partners to maintain Colorado's stable medical liability climate. Finally, the known unknown. What does that mean? So we have a rigorous stakeholder process during the interim between sessions where we talk with all sorts of folks about what they're going to be bringing or what they've heard is going to be brought in the 2022 session. So these are bills that may not be our highest priority, but certainly impact physicians and that we will be looking at closely. We've also got our amazing Council on Legislation that meets twice a month, every session, all session long, and they are always poised and ready to work on those known unknowns. So why don't I hand it back over to you, Chet, to talk about our opportunities.
Thanks, Emily. We do have some opportunities in the coming year. One of them is going to focus on a pain point that we hear from physicians and their teams all the time. We know that prior authorization not only is a hassle and a cost for you, but it also has negative impacts on patients. We have been working on this bill this issue for many years, and we actually got approached regarding a bill by Senator Kirkmeyer. The concept here is essentially if you adhere to carrier rules with regard to prior authorizations and you meet certain thresholds, then you get a gold card, meaning a pass, and they won't use prior auths on you for a certain period of time. That could very much reduce administrative burdens. Next, there are some opportunities with regard to workforce because we have heard loud and clear, not only from you, but from other healthcare providers about the stresses and the strains that the workforce across Colorado is currently experiencing. Some of this, of course, is brought on by the pandemic, but there are other forces afoot, and they have been exacerbated. Some very important one-time federal monies will be considered in the coming year. There's been certainly a focus with those monies on things like mental and behavioral health. We're also looking to seize opportunities to address other issues for physicians and other clinicians to expand access to care, especially in parts of the states, in part of the state where patients can't get as timely access as they do in other parts of the state. Last but not least, out-of-network and surprise billing. We passed a bill a couple of years ago that addressed some of these issues. We recognize and certainly don't support any surprise bills, and note that out-of-network issues are actually part of a larger issue regarding network adequacy and the interface between carriers and physicians, contracting, administration, and all of those issues. We know it's complicated, and we also know that the federal government recently passed a bill called the No Surprises Act. So one opportunity this year is how the federal bill can be aligned with some of the state bill that had already been passed to make some fixes. Those are opportunities that we expect. Emily, back to you.
Fantastic. Those are some great opportunities. To give us a little bit of the political context behind our 2022 anticipated priorities, I'm going to hand it over to Jerry Johnson.
Thanks, Emily. Well, the clock is ticking down on the start of the 2022 legislative session, which begins on January 12th in 2022. I'd like to take just a few minutes to describe what we expect at the Capitol during the 120 days of the session. And then Dan is going to talk about what we expect to happen during the election in November. So going into the next session, we know a lot. The major players are the same governor, the same state Senate with its leadership, the same state House of Representatives with its returning leadership, and the same makeup of House and Senate committees. We know that the state is awash in federal stimulus dollars, but these are one-time monies that must be spent by 2024. That raises the question: if we establish new programs using one-time federal dollars, can we afford to continue the programs with state money when the flow of stimulus dollars ends? We know that legislators are expressing a lot of concern over two issues that doctors care deeply about. The first is expanding mental and behavioral health treatment programs. Those of you who participated in the CMS candidate interview process, which Compact oversees, got a taste of that during the 2020 election cycle, when we talked to candidate after candidate of both parties who identified mental health issues as one of their major concerns. And secondly, legislators are concerned about expanding the pipeline of healthcare workers. The Interim Healthcare Task Force has taken lots of testimony, including that from our own president, Dr. Mark Johnson, on different shortages in the medical and healthcare professions, nursing shortages, physician shortages because of burnout, surgeries being canceled because of staff shortages, and so on and so forth. And finally, we know that our traditional adversaries are still out there promoting issues that physicians largely oppose, including the threats that Emily enumerated a few minutes ago. There are two theories about what we can expect during the 120-day session that runs from January to May next year. The first is that the majority party, worried that the Senate will flip from Democrat to Republican in November, will try to pass every issue on the progressive agenda that they did not accomplish in 2021, including perhaps programs funded with cuts to physician reimbursement. Or secondly, that the majority party leadership worried that recent election results in Virginia and New Jersey signal voter discontent over issues like defunding the police, and will revert to their historic, more centrist legislative agenda. But as Dan will describe next, a lot of current members will be looking at a run in a different district in November, sometimes a district having a different constituency. And members may be much more cautious about supporting ideas that are important to one of their constituencies, but not broadly supported by the people of Colorado. However it plays out, we can predict with great certainty that we will be busy. And to achieve the level of success you have come to expect from CMS, we will need the active engagement of physicians across our entire state. Thanks, Emily.
Thanks, Jerry. Dan, could you tell us a little bit about what we can expect in November of 2022?
You bet. Thanks, Emily. Thank you, Jerry and Chet, for your updates. First, before I talk a little bit about November 2022, I want to talk about what got us to November 2022. In 2018, overwhelmingly, the voters approved referendums Y and Z, which created an independent commission to draw the new districts for both the congressional and the legislative districts in the state of Colorado. Right now, I will just talk about the legislative districts, which was just approved on Monday, the 15th of November by the Colorado Supreme Court. That was a very important date because legislators in Colorado have to live in their district for 1 year before they are allowed to run for that district. So, as Jerry stated earlier, there are several legislators with these new districts who their districts have changed considerably and have been drawn into other races. There will be 4 or 5 races where incumbents will be facing off with incumbents. And there are 2 legislators that have lost districts totally that have to move in order to run for office. So let's talk a little bit how that's going to impact November 2022. In November 2022, going into that election, it is thought that there will be 15 safe Democratic seats in the Senate and 13 safe Republican seats with 7 competitive seats. The definition of competitive by the Independent Commission was a plus or minus 5. So of the 7 competitive races, 6 of them are actually less than 4% advantage for either party, with 2 of them being 2% or less. So we're going to have some very competitive races in the Senate. The party that has the best candidates that match the district and run the best campaigns will have the best chance of gaining the majority for 2023, 2024. In the House, which has 65 seats, there is now thought to be 35 competitive districts in the House moving forward. Currently, there is a big advantage for the Democrats in the House, 41-24, but now with 35 competitive races, it is thought that that number will shrink moving forward. One thing I think we can count on for certain in the 2022 election, they will be some of the most expensive state races that we have seen in our lifetime. With that many competitive races, the amount of money needed by each party will double or triple over the prior years, because historically there has never been that many competitive races before. So I think what we will find is in 2022, a very exciting election night with a lot of undecided races going actually into the night. And we will find a very, very expensive election cycle due to the competitive nature of more of the races. that the new independent commission created. Thank you, Emily.
Thanks, Dan. Thanks, Jerry. I think everyone listening can probably tell why we always say we have the best lobby team down at the Capitol. Chet, why don't I turn it back over to you?
Thanks, Emily. The stage is set. I think both Jerry and Dan laid out not only the opportunities and challenges during the upcoming legislative session starting in January, but importantly, also November and beyond. And this is where you come in. We really do need your support. We need your support for Compact. We need your support for the CMS small donor committees. Take your phone out right now, scan that QR code and make these donations. These donations fuel our advocacy work. They help open doors and they help elect legislators from both sides of the aisle that are physician and patient focused. This is cost of practice, and we really hope that you'll help us get this work done. Last but not least, I ask that you stay ready and alert in the coming months as we do more of these updates, send you more videos, send you action alerts, and other email information. Be ready to respond, and together I'm sure we're going to have a good session and a good election cycle in November 2022.
I couldn't agree more, Chet. And I also just want to emphasize CMS is here helping physicians when you need it. So that's always the services that we're trying to provide. I'm so glad that we could have this time today. I hope you learned a lot and enjoyed yourselves. Also, if you have any questions or comments from this video or takeaways, please feel free to share them with us. Send them to membership@cms.org. Thank you so much from our whole team for being with us today.